know there's a few people joining, but we'll make a start because we want to have some time for questions at the end of today's session. So good afternoon. Welcome to everybody who's joining on today's group briefing. We've got a really good set of things to try and talk with you today. So if we can have the next slide, please, we'll just talk about some of the housekeeping, which hopefully you all know by now, but it's worth just reminding us. So if you can just be on mute unless you are talking, that would be really helpful to make sure everyone gets really good quality. If you want subtitles to understand what or so have some extra assistance on what people are saying, then you can do the subtitles moment there. Hopefully we know about turning on cameras on and off at the minute. And then most importantly, if you want to ask some questions in the course of today, you can of course use the chat button. Colleagues will be monitoring that, and we'll try and make sure that we review them all at the end to make sure we've covered them, providing we've got sufficient time, that is. So that'd be great if you can use that. Okay, well, on to the next slide then, please. So this is what we're going to try and cover today. We've got four kind of areas: our hospitals, our wellbeing, the excellence programme, and dedicated to excellence. And you'll see there's a number of people going to talk through those, and we'll just pass to each other in an amazingly seamless way as we go through the content today. So that'd be great. And next slide, please. And so I'll just talk about our hospitals and then I'll pass on to Faye. So this is a completely weird moment where I have to talk about me leaving and somebody else joining. So you may have seen I'm on my way to join Nottingham University Hospitals as a Chief Digital Information Officer in January. Regarding what it means, regarding while Simon is off sick, we'll be looking to see who takes over the interim group chief executive role that I've been filling in during that time, and that'll be announced in due course. And exciting news that Susie will be joining us as the Group Director of Comms and Engagement in mid-February. You'll see Susie's a former journalist. This isn't a coincidence, but she's currently at Nottingham University Hospital. So contrary to popular belief, it is not a prisoner swap. No, it just sort of happened two independent moments. But yeah, you'll see there's some irony in that move there. So yeah, really look forward to joining Susie joining us in the new year. And I'll hand over to Faye now.
Thank you, Andy. Yes, so I guess winter is well and truly with us, although arguably I think we all think it never actually goes away. But certainly the last few weeks have been incredibly difficult for everyone concerned, particularly our emergency and urgent care wards and departments, as we've seen an increase in our attendances. Interestingly, we've also seen, excuse me, sorry about that. We've also seen an increase in paediatric presentations, with both units on both sites seeing their acuity and admissions rise. Certainly with respiratory illness, which it tends to be at this time of year, so it's not a surprise, but certainly we are noticing increased pressure on our paediatric services. Flu is also present is on the increase, and that's also contributing to the number of admissions that we have throughout the hospitals. And also it creates some more complexity for the hospitals when they're trying to juggle flu and COVID, particularly as we're trying to isolate those patients into side rooms. So we know it's busy, and we have been pretty much planning for this winter all year round. NGH recently had a multi-agency discharge event that went really well. And a message from the operation teams and Palmer was to say a massive thank you to you all for engaging in that process, and also the national and our system partners also contributed to that, so a big thank you from them. There's always really good learning opportunities when we undertake those kind of in-depth analysis of what's going on and in our hospitals. So they take a lot of effort to organise, but they certainly do add value. So we know it's going to be difficult. We know we have got to make sure that we are handing over and accepting our patients from the ambulance service as quickly as possible. And that's becoming increasingly difficult, not just for our hospital, but across the region and nationally. The good news is that KGH and NGH are pretty good at that. And actually, we rank one of the highest in the country for making sure that the crews for EMAS get right back on the road as quickly as possible so they can get back out to those patients that most need them in their homes. So that's really good. But one of the things we started to do is the rapid flow models. Now, KGH and NGH have approached it in a very different way. North Bristol Hospital also implemented a model, and what both hospitals are doing are adopting some of the principles. And what that means is that we will get flow nice and steadily across the organisation, not all at once like we tend to get later on in the day, which creates problems. So we know it's going to be busy, but what we're trying to do is manage and share the risk across our whole hospitals. So we know it's a change for everybody in the way you're currently working. But I have to say, we've certainly been absolutely amazed by the commitment and the way it's been perceived on the wards has been just absolutely amazing. So thank you, because we know whether you work on a ward or whether you work at the front door in accident and emergency, you're all working incredibly hard, and we're always asking more of you. So a big thank you for engaging in that process. So just to end on a positive, elective and cancer care still continues. It still very much remains a focus for all of us. And the good news is, again, that Kettering and Northampton are both up there in terms of the best performers when it comes to elective and cancer care. We know it's not where we want to be, but what we do know is we are doing the very best for our patients. So again, a big thank you to all our teams, from admin to the consultants, the nurses that are all involved. You all play such an important part in maintaining those waiting times. So thank you for that. So if we just move on to the next slide, please. So you will all be aware that we are planning for the forthcoming strike action. So really, it's just to say that as both organisations, we're working really closely as a group with support from Paula, who will talk later. And what we're trying to do is come to a common ground really about how we're going to manage this situation as we get closer into it. So just to say, we are absolutely committed and support all staff that want to go and strike. We know it's a difficult decision, but just to say that we are aware that, you know, we will support you to enable you to take that strike action, and we are working really hard across the system to make sure that we keep our hospitals safe while we do that, to enable you to do so. There'll be more to follow on that. We are at our early stages of planning, but just to let you all know that we have started. So I will pass you on to John now for talk about the money. Thank you, John.
Thanks a lot, Faye. So I've got a more difficult probably slot today to update on where we are with the money, kind of where we've got to in terms of our assessment of year end, and what that's likely to mean for us in terms of kind of internal controls and oversight from colleagues both within our system, the Northamptonshire ICS, and then more widely in terms of NHS England. So the money's in really a difficult place. I can't really sugarcoat that. Some of the sizable risks that of things that we'd assumed in our 22-23 financial plan have materialised. I mean, we were asked to plan for kind of a lower level of inflation than we've seen. We're asked to plan for a very minimal impact of COVID. And we were asked to plan for a situation where flow through our hospitals and discharge were not a problem. And all of those three things have been significant challenges to a greater or lesser extent this year. And clearly that has an impact on our resourcing and the money. We are looking at a deficit across our two hospitals of about £36 million. That's current assessment, and those numbers may change. And that means that we would be worse than plan by about £29 million, or round it to 30. That kind of variance to plan is split broadly 50-50 between Northampton and Kettering. So we haven't got a significant difference in terms of movement against plan at either hospital. but both of those are significant in of themselves. And across our ICS, we're looking at a deficit overall of about 47, which includes that kind of 29 that I've described. Those are really quite big numbers. I've had conversations with regional colleagues in the recent weeks and months, and we will be, if those numbers materialise, quite a significant outlier compared to others. Just to give you some context, another system who are already in increased oversight from NHSE for being off on the money are looking at a year-end position with a deficit of about 35 million. And their system is twice the size of ours. So we're looking at a large deficit, 47 for our system, and half the size of one of the systems that's already been in national escalation, that kind of highest level of oversight and escalation. What does that mean for us? We will, when we reforecast a year-end position, which we've yet to do, and we need to go through a set of formal processes before we do so, there will be quite a significant increase in imposition of further controls. So we will be unable to sign off any investments internally above £50,000. There will be further and tighter external controls around recruitment for substantive staff, for temporary staff and for consultancy. And we have already been asked to carry out quite a detailed workforce review of our movements in workforce between pre-pandemic to now. And whilst we might think that kind of crude analysis of where we were now kind of 2.5 years ago is irrelevant, the questions being asked of the NHS by the government and by our taxpayers are, what are the increase in workforce across the NHS doing, and how are they delivering increased volumes of care, and bluntly, what's the productivity look like? Now, our operational performance across both hospitals in terms of waiting list and waiting times, as Faye just referred to, remains one of the best in the region. We should be and are congratulated for that, and you collectively should be congratulated for doing that. That is no mean feat, and we have recovered activity, certainly planned care activity volumes, far more effectively than other systems within our region and nationally. So a big thank you for that. However, the volumes that we're delivering kind of in aggregate across both hospitals still remain lower than pre-pandemic levels, despite the fact that we have increased workforce and we have an increased spend on waiting list initiatives and insourcing. And the very blunt question we're being asked is, why has your productivity dropped? And I'll come on to that in the next couple of slides. Could we go to the next slide, please? So what does that mean? So in broad and blunt terms, we have increased our workforce compared to February 20, just before the pandemic hit, by about 10%. Those vary by staff group, they vary a little bit by hospital, but not a lot. And we haven't seen comparable increases in clinical activity, certainly in planned care. And whilst we've seen ups and downs in minors and others within urgent care, we certainly haven't seen them in terms of admissions. So we are struggling to explain that narrative, what our increased workforce is doing. There are clearly some challenges around safety and quality, and we made a conscious decision to invest in a number of clinical services and corporate areas, for that matter, during the pandemic, and we are not delivering increased output on the back of that. By and by, that coupled with we have struggled to deliver our as usual efficiencies, so our 2%, and we've also struggled to translate those kind of wider programs of change, be it ICANN or theatre productivity, into removal of costs. Yes, the assumptions that we're asked to plan for have not come off as expected, but those are not the major reasons that we've got a problem on the money. It is our increased workforce, and yet funding hasn't gone up comparably, and it is because of our delivery against efficiencies and cost out impact of kind of change programs. Our boards at the end of October agreed to do a number of things. One, institute additional kind of grip and control measures, both on pay and non-pay. Those are not to take away the responsibility and autonomy of budget managers. Indeed, now at any point, as if it is more important than than ever that budget managers and senior leaders exercise as reasonable and very rigorous controls on resourcing. We are going to be asked externally to explain from a board level what oversight we have of controls. We will be expected to put in things like vacancy control panels, review of discretionary spending, non-pay, etc. And we're in the process of putting those processes in place, and we'll communicate those more widely in the next couple of weeks. We need to work out a way to step down the additional costs we've added in urgent care. They are different at Northampton and Kettering. Kettering's predominantly escalation capacity. Northampton, because of the constrained estate, is extra people in ED or on our wards to support increased dependency. We need to work out a way, given the investment that we're putting in out of hospital capacity this winter, how and under what conditions we can stand those costs down. And then that question that I've raised before around removing additional workforce above pre-pandemic levels, we need to continue the work that we've done in quite a lot of detail in urgent care, but in other areas where they are not justified or value adding. And by value adding, I simply mean in planned care, we aren't delivering more activity as a result of it. We clearly need to refocus our transformation programs to cost out measures. We have been very successful in the volumes of activity we're delivering on planned care. The balance between the money and the performance is not where it needs to be, and we need to rebalance that. We'll clearly need to work through what the performance implications will mean, and weights and others. So that is work in training and progress, and colleagues will be involved in that work. Next slide, please. And then kind of the final point for me is why bother? So as I've said, we're an outlier on the money. The controls are going to be imposed upon us whether or not we like them or not. But we want to, and we need to. We've got a plan for quite significant investment in the estate at Kettering. We want to be able to support clinical developments at both of our hospitals, to support our academic strategy, to support our clinical strategy, to support our centres of excellence. And the only way that we're going to be able to free up resources to be able to do that is to get the money in a better place. That can and needs to start now. The better position we get towards the end of this financial year, the better position we're in going into next. And you can see that, you can work that kind of story out for yourselves. But only by improving financial resilience are we going to be able to do those more discretionary things in terms of development and really shore up operational resilience. And from an oversight point of view, only then are we then going to be able to kind of remove those controls and oversight measures and really be able to direct those resources as we want to and as we see fit. So we're in a difficult position. The NHS in its finances overall is in a difficult position. We are in a worse position than most, and the expectation on us is that we work through a set of situations and decisions on how we can balance the money with performance. That's conversations that we'll carry out at boards over the next couple of weeks. NGH is tomorrow, KGH is the following week, and we'll continue to work with yourselves, in particular clinical and operational colleagues, and then wider system colleagues to work out that best balance. I'm passing over to Paula. Thank you.
Thank you, John. Follow that, as they say. So I'm just going to pick up on something that Faye said. So Faye was talking about industrial action. I haven't got any slides on industrial action today, but I'm very happy to take any questions that colleagues may have. As Faye said, it is early days with that at the moment, in so much as we've had the result of the RCM ballots to support strike action at Kettering, not to support strike action at NGH, albeit it is worth saying that the reason that NGH didn't get a vote to support strike action was that they didn't get quite enough participation, but of those who did vote, there was a very high proportion of people who were in favour of exercising their right to strike. So we are working, there's a group of us working to look at planning for maintaining services and how we will operate during strike action should it occur. We are due to hear from the RCN this week as to whether they will be striking before Christmas. So myself, Faye, Palmer and other colleagues are looking at the approach that we will take to make sure that we're able to support colleagues to exercise their legal right, but also obviously maintain services and protect services for our patients. But if anyone's got any questions at all today, please put them in the chat or put your hand up at the end, and happy to cover that off if I can. But supporting our staff. So next slide, please. So staff survey, we are in the last few days of the staff survey. These are the participation rates so far. Really pleased to say that NGH's participation rate has gone up from last year. So brilliant work, NGH colleagues. Keep going to the end of the week. KGH slightly less than where you finished up last year at Kettering. So again, anything that anyone can do, please, to support teams to have time to complete the survey. The more people who complete the survey, the more accurately colleagues' views of what working in UHN feels like and is like, and the experience that people have. And the more accurate our view and the more accurately those views are represented, the better we can provide a response to that. So the more people fill in the survey, the more we understand how people feel about working here. It's completely confidential. We do not know who has filled out those surveys. We know the departments that people work in, but we don't know who has filled out the survey. So you can be assured your views will not be shared and will not be known by others. And as I say, really important to have high numbers of people complete the survey, so it's a really representative view. So if you have any capacity to support staff to fill out the survey, to create time for them, that's the most important thing we can do. So up until Friday. And if you complete your survey by Friday, you have the chance to be in our draw to win 2 prizes of £500 or smaller prizes as well. So that may also be a motivation for some people. So please fill out your staff survey. Next slide, please. So we have already had a draw, and there's a lovely quote there from Sam. So again, Sam exercised his voice, had his say, and was a lucky winner of one of those cash prizes. So good news for Sam, and maybe that could be good news for you as well. Next slide, please. The staff app, we have launched new apps in both organisations. You can see a QR code there. So if you've got your phone at hand and you want to download the staff app for your trust, then please do so. It's extremely useful. You can get your emails on there. You can access the roster on there. There's all sorts of information. So for example, our new financial wellbeing toolkit is on there. Really easy to access and makes it easy to access things from home if you're not at work. So we will be adding more and more content to the app as we go. If you've got suggestions for things you would like to see in there, please contact the comms team and let them know what you would like to see. But that is a new facility for colleagues at both organisations, again, to help people remain connected with teams, with colleagues and with the hospitals. Next slide, please. Vaccinations. You'll all be aware, I'm sure, that we are offering the vaccination service at both organisations at the moment. You can get your COVID vaccine, you can get your flu vaccine, or you can have both together. Really, really important at this time of year to get your vaccine. We've already heard about increased demand on the hospitals, and this is one way to help to keep yourself safe, to protect your family, your loved ones and your patients. So if you haven't had your vaccine yet, there is information in both trusts on how to get the vaccine locally in your hospital. Both sites are doing drop-in sessions, and both occupational health teams are happy to come out to your ward or department to make it easier for colleagues to access the vaccine if that would be helpful. We do also know that quite a few people get their vaccine elsewhere because it's more convenient. If you've done that, it would be really helpful if you could let us know, because then that can be updated on your occupational health record as well. And the team have developed some handy QR codes to enable you to do that, and those are shown on the slide here. So just a reminder, if you haven't had your vaccine yet and you are intending to do so, please contact occupational health and arrange a time that's convenient for you to go and get your vaccine and protect yourself and others. Next slide, please. This is information about a service that we have mentioned on here before that has now come to fruition. So firstly, my thanks to Claire Hallas, Anne-Marie Dunkley and Sarah Faraday, who have been instrumental in pulling this together with our partners, the Trussell Trust in Kettering and Restore in Northampton. We all know, we've discussed it on here before, the financial challenges that everyone is facing. And we know that some people are in really, really stretched circumstances. And at those times, accessing a food bank can make a difference. It is difficult, of course, sometimes though, when you're working to access a food bank. So colleagues in the Health and Wellbeing team have got together in partnership with those two local organisations to arrange for you to be referred from the hospital into the local organisation where you can then go and access food bank service at a time that is convenient to you. So it makes it easier to access the service by facilitating the referral in work rather than needing to sort that out outside of your working hours. The team have launched a very simple form that you fill out that will be publicised from Monday, and then that will enable us to refer you through. We're also very aware that quite a lot of colleagues may not need to access that service, but do feel that they would want to do something to help others who may be in really challenging circumstances at the moment. You know, if there's one thing I know about colleagues in the NHS, our motivation for being here is to help others. Almost, you know, 100% of us feel like that. And this is a really practical thing that people can do. So in partnership again with the Trussell Trust and Restore, we're going to have collection places at each trust. So if you are in a fortunate position where you are able to make a small donation to help others, then what we will do is be passing the things that are donated back to our local partners so that they can be put into the food bank service. So hopefully that's a way to help colleagues in need, but also for us to do something practical as well. And I think I'm now handing over to Becky.
Thanks, Paula. I'm Becky Taylor. I'm Director of Transformation and QI across University Hospitals of Northamptonshire, and I wanted to talk today about Dragon's Den. Now, we've talked about this over a couple of the recent group briefings, but we had our Dragon's Den. Some brave teams entered to pitch in front of our Dragons the week before last, and it was a really fantastic evening, and we had 4 judges on the panel. So we had our very own chairman, Alan Burns, we had John Evans as our chief finance officer, and we also had 2 local business people, Becky and Steve, who came and joined the panel, not from the NHS. And I think everyone was absolutely blown away by the passion, the commitment, the dedication, and the kind of real innovative ideas that people across the hospitals had come up with. And Steve, who, like I say, was a panel member, one of our Dragons, came up to me afterwards and said, you know, you just don't see this sort of passion and commitment and dedication. He works in marketing in the same way, and the real commitment to patient care. And he really wanted to feedback how absolutely blown away he was by the teams and the enthusiasm that people had. So we've got some pictures here. John's just put a link in the chat to watching it if you wanted to go back and watch it. We did have it live streamed. We were blown away internally by the number of entries that we had. We had 61 entries. They were all phenomenal. We had a really tough time shortlisting them. 7 pitches to the Den, and 5 of them were fully funded, although we will be supporting all of them to take forward their project plans. And so on the next page, I just wanted to say a massive congratulations to all of our winning teams. So we were able to support the volunteers with improving the Brew Buddy service, beds for babies, supporting families of premature babies at NGH, the Swan room to support providing rooms and spaces for families of patients receiving end-of-life care, digital posters from our communications team so we can get some of that comms out in the organisation, and supporting making sure we've got better blood monitoring for patients who are on non-invasive ventilation. So it was really fantastic. But what I really wanted to do was spend a bit of time with a couple of the teams who were successful on the night. So without any further ado, I will hand over to the Swan Room team. Hopefully Kerry is here. Yes, there you are, Kerry.
Thank you. Thanks for the invitation. Just wanted to say that we've had some really positive feedback from families who've used our pilot Swan rooms, and we wanted to roll this initiative out further across the trust. It was a fantastic surprise to be shortlisted for Dragon's Den. We were quite nervous about our pitch, and we were up against some really strong competition. We asked for funding for one room, which is £3,500, and were totally overwhelmed and extremely thankful to receive funding for 5 Swan rooms, which will enable us to roll these out now across the trust so that we can go to surgery and elderly medicine and other specialities within the trust. It will make such a difference. It demonstrates how much NGH are prepared to care for dying patients and their families. And I met with a gentleman yesterday who had donated £3,500 for another room because he found it such a positive experience. So I can't thank you enough. It really was a positive experience doing the Dragon's Den, so thank you.
Thank you for your, like I say, ideas and passion, and it was quite emotional on the night, I think, wasn't it?
It was, yes. I think we were all overwhelmed to be a winner and to receive so much money, really. Just one room would have been fantastic, but 5 was just brilliant.
Super. Thank you, Kerry. Thank you very much. And then Emma, I think, is going to talk a bit about the Brew Buddy.
Yeah, hi, thanks for having me. Yeah, the night was a lot of fun, and we brought some of our volunteers, Emily and Karen, with us. They had a great time. It was really nice for them to meet new people, well, for all of us to meet new people, and see like the bigger picture of the Brew Buddy and why we do this. So it's really about supporting staff well-being and trying to get a really large reach across both sites and get to as many departments as we can. So the money that we received enables us to buy 2 trolleys for either site, so 4 trolleys in total, and we can hold a lot more equipment on them, a lot more stock. We don't have to break our backs trying to get around the hospital on our little trolley that you can see in the picture there. It also just gives us a bit more security with our stock and funding, and we can just be a lot more adventurous with what we can do. So yeah, we're really pleased with how the night went, and it's just given us a massive boost here, and the Brew Buddy a big boost. So yeah, if you see it out and about in Northampton and Ketchin, then you know, give it a wave and get a hot drink off there. And keep an eye out for all our plans that we've got for Christmas, because we're going to go big with it. So yeah, thanks so much.
Thank you, Emma. And I have to say, I thought your pitch was amazing. For those of you, they were up there, so if you do watch the video, you will see the airline hostess trolley pitch, which was fantastic. So
Yeah,
it's a bit sad you didn't still have your hat on the next day.
I know, I was debating it. I thought, shall I get into character or?
So yeah, so thank you very much. And these are just 2 of the teams that came, and I think it was a real testament to how innovative some of the teams have got, some of the improvement ideas that people have got, and hopefully we'll be able to do this again in future years. It was a really good evening. Thanks.
Yeah, and to say that you're there for triage.
Thanks, Becky. Yeah, so we'll continue on the theme of sort of celebrating our staff and their contribution as we talk about the long service awards. So if we can have the next slide, please. Yeah, so many of you will be aware that we've recently had some long service award celebrations, and a number of staff were invited to come across and join in that celebration. You'll see there the number of years celebrated. So we did a bit of a catch up because we haven't done this over COVID, but KGH, there was 167 staff that qualified for the milestones that totaled 4,920 years. And at NGH, there was 206 staff that had reached a particular milestone, and that's 5,975 years of service, which is just absolutely amazing to sort of recognise the people who've given their loyalty and contribution to the organisation for such a long period. If we go on to the next slide, we'll be able to see some of the people receiving their prizes. And whilst I'm not going to sort of talk about those in particular, because there's more people obviously on those pictures than others, I'm going to just pick out a couple of stories that's there. You may see also in the chat there was a couple of recordings that were made in some podcasts for the Long Service Awards, where there's been interviews with different people about their contribution towards the organisation, and really sort of things that they've seen change over the course of some incredibly long careers. So there's the links in there, and our very own John Levers, with his silky voice, you'll hear him talking to various colleagues in there. So just a couple of things from that podcast, just to wet your whistle. We hear from Michael Panter, the mortuary manager, who started as a domestic, just as a fill-in, didn't think he would stay, but has been here for 25 years. And we hear that during COVID, he played his guitar to entertain staff in the care cafe. So brilliant to hear about that. We also heard from Claire Russell at KGH, who has 33 years service, but it's a family business because Claire, her mum, and her three sisters, between them, have 150 years service in the NHS. And we also hear on the podcast for NGH for Ursula, who's worked in the NHS for 49 years and 30 of those at NGH. She said that she started as a student to radiographer, sorry, in the UK, the year that ABBA won the Eurovision Song Contest. So some context there, and she talks about how CT has really evolved in the course of her career. So really invite you to listen to those recordings. They're pretty short, you can listen to them, but it's a really great moment to celebrate and recognise some staff who've been with us for such a long time and make such an outstanding contribution. So thank you very much to everyone who's there, and we look forward to those events continuing now that we're able to do them more often. So we'll go on to the next slide, please. So we have a moment here to talk about the sort of questions that's been raised. I know colleagues have been responding to them as we go through. Paula, I think probably if I can come to you, and I know you've answered this in the chat, but it is something that comes around every year around the anonymity of the staff survey versus being able to identify people for the prizes. So be great just to hear you say a bit more about that, please.
Yeah, absolutely. So the staff survey is not administered by either Kettering Hospital or Northampton Hospital. It's administered on our behalf by a third-party organisation who's contracted by us to do the survey. So the results go straight back to them. We don't see any of the results. We don't send anything out. And they also very kindly will administer any prize draws that individual organisations want to do. And as you'd appreciate, quite a lot of NHS organisations do something like that to encourage colleagues to have their say. So we tell them the prizes that or the number of prizes that we want to issue, and then they draw out the corresponding number of winners. They tell us who those winners are, and then we contact people locally. So we're not involved in the selecting the winners of the prizes. We don't get to see any of the survey forms when they're filled out. They all go off to the company's called Quality Health. So we don't get to see any of that. All that we will get to see is the numerical data that comes back with the analysis, and then any free text comments that people have put in. whatever they are, positive, negative, anything at all, we get those just listed out in a great big, long, huge Word document that comes out. So none of those things are attributable to any particular department or person. So it really is completely anonymous, and you can be confident that that is the case. So I hope that that provides a bit more context and reassurance around that.
Thanks, Paula. I think the other thing to pick up in the chat is, you know, people recognising and celebrating the Dragon's Den event. Again, if you weren't able to come to it, looking at the video is really great. And John has got his podcast thing on again and is putting that together. So we look forward to hearing that as well. So yeah, just echo the well dones to everybody for contributing to that. And you see that there's more opportunities for colleagues to join in with Brew Buddy along that as well. So I'm not seeing any other questions in the chat along those lines. Happy to take some questions if anyone's feels able to put their hand up. Otherwise, we'll just give it a second or two. Becky.
I just want to come in. Sandra just put something in the chat that I absolutely forgot to say. We really could not have organised the Dragon's Den and run it without the teams putting in all the effort for the prep, but also the team who organised it. So that was a joint effort between volunteering, the quality improvement team and communications. And we also had some support from a really good company who helped with all the streaming and the video. So yeah, massive well done and thank you to the team for that.
Yeah, brilliant. Echo that. Absolutely. Yeah. Thanks, Becky. Okay, so it doesn't look like there's any more questions. So we'll close the call. Just want to thank you for coming on and listening today. Again, if there's things that occur to you afterwards, by all means, put them in the chat or just get in touch with me or one of the comms team, and we'll do our best to sort of respond to you in that way. But other than that, you'll get 15 minutes back of your time. Have a great afternoon. Thanks a lot. Bye.